in the military. I was in the Air Force, trained as a scrub technician in the early 80s, and maintained or gained my certifications as a surgical technician and a surgical first assistant. Well, having been a principal of Omni means that I not only was out in the field doing the job, but I was also handling a lot of the business elements of running a business. And that was somewhat overwhelming because my days had a tendency to be 14, 16, 18-hour days, and then I was trying to put out fires and deal with the business elements. That's not to say that I didn't have a lot of help in our office. Annie Cloud and Whitney were both tremendous in helping us keep the business going, but I think that my partners and I saw that that growth had somewhat stymied, and we felt like that we needed something to take us to the next level. And Jackson offered an opportunity for us to grow, not only for Omni but also for the field of surgical assisting, especially here in the metropolitan Atlanta area. I specialize in orthopedic and neurospine surgery, but I do just about anything else. Well, I think it's becoming greater and greater as healthcare changes. When I first started in this business, I basically was a second assist because there was always two surgeons, the primary surgeon and then his assistant, which was generally one of his partners. And then I stepped in over a period of time when I proved that I could do basically what that assistant surgeon was doing, and that allowed that assistant surgeon to be freed up to see patients in the office, which in turn creates more revenue for the practice, which is a business. And in doing that, over the years, we've stepped in and filled the shoes of the assisting surgeon more and more often, and I think we will continue to do that more. A surgeon who has a physician's assistant, a lot of times it's just not conducive to have a PA come into the operating room to assist on a surgery when they again could be in the office doing follow-ups, seeing patients, etc. Again, more of a revenue producer for the practice, and that's where we come in, is we can step in and be that assistant that they need in the operating room. Well, in medicine in general, but especially in the operating room, there is a certain pecking order, if you will. And I think that humor has a lot to do with maintaining that camaraderie in the operating room. What we do is stressful, and what we do is very demanding, and we all want to do the best we possibly can do for that patient. But in order to stay focused on what we do and take care of that patient, a lot of times it's just the humor that's shared between the individuals in the operating room that helps us stay focused. I'm not saying that we're in there laughing and joking and having a good time all the time, but a lot of times in that pecking order kind of goes away because the nurses depend upon us, the doctors depend upon the nurses, and we depend upon all of them. And it's a codependency thing. We're all dependent upon each other to make sure that what we do is take care of that patient to the best of our abilities. So it's a family sort of thing in that operating room. A lot of times, especially if you're in an environment where you're there every day or every other day and you're doing the same procedure, you want things to be routine in the operating room. And so that little niche of people there that you have, you're with for, 8, 10, 12 hours sometimes. So you have to have a certain level of levity in the operating room, and I think that helps in maintaining the camaraderie of the people in the OR. Well, again, I have to go back to where I came from, which was in a position that I really never saw myself being in, which was being a CEO of an organization, and not only trying to do the job, but also maintain the business. And that was very stressful. And again, my partners and I felt like it was not advantageous for us to continue on the way that we were. First of all, we weren't progressing. And second of all, we were ourselves aging quickly. And this provided, Jackson provided us with an opportunity to see us as individuals grow, and the organization grow, and the field of surgical assisting grow. So that's why. I am. I'm very happy. I guess I could say I have my life back, in that I have the work that I want to do, as much of it as I can possibly handle, and I have the ability to still have interaction with my family and my time, and I have the opportunity to grow myself. So yes, I'm very happy with it.